Right now, we are only we only have Plan 1, the medical Plan 1. The brochures include all of the medical plans that they offer, as well as dental and vision. If you've got questions about that, that's fine, but just know that we're not providing those plans this year. But you still might have questions about how that might work in the future. So it's going to be a presentation, and then if you've got individual questions, you can ask individual questions or group questions. So,
perfect.
So thank you and welcome.
Well, good morning, everyone. So my name is Nancy Oliverio. I'm kind of stuck to this, so sorry, I'm not going to move around too much, so that way we're captured on the video. So how many of you are familiar with Kaiser Permanente? You probably maybe seen the building, kind of, sort of. Okay. That's why I'm here, to help explain to you a little bit about who we are and our presence here in the Eugene area. I'm really excited, especially since I get to come down here more often and maybe catch a duck game or two. Anyways, so Kaiser Permanente. You've probably seen our medical office that's in downtown Eugene. So we have one medical office and one dental office. And you're probably wondering, what is Kaiser? So Kaiser Permanente, we're what's called an integrated medical system. So what that means is, we're not only your insurance carrier, but we're also your medical provider. So the beauty of that is everything becomes more seamless for what we call our members. So when you go into the medical office, you're able to access a multitude of services within one location. Right now, the downtown Eugene medical office has primary care services. We don't yet have pharmacy just yet, but I'll go into that in just a little bit. And then we have our dental office as well. So the great thing about that integrated system is, whenever you go into a Kaiser Permanente facility, you'll know that when you talk to a physician, so your primary care physician, or if you talk to a specialist, or if you talk to a nurse or a pharmacist or a lab tech, all of our, we have what's called an electronic medical record, and so all of your health record is housed within one system. So what that means for you is we have that beauty of coordination of care for our members. So rather than having your care be fragmented, where you have to carry your medical record from one physician to another and having to remember what your prescriptions were and what your health history looks like, leave that up to us. We're able to see and track all of that for you. Okay, so that's just a little tidbit on what the integrated system looks like. Any questions so far? Okay, so this is the downtown Eugene medical office. It's in the old library. What I'm really excited about, and if you've probably seen some of the collateral that I left back there. So coming May 2020, we're gonna be relocating to the Chase Garden Medical Center. Really excited about this because this is going to expand the access for all of you. So within this new building, it's going to span a little bit over 18,000 square feet. It's going to have not only internal medicine, family practice practitioners, but we'll also have labs, x-ray, and pharmacy services, as well as behavioral health within this location. So park once, go and see your primary care physician, and be able to access a multitude of different services within this one building. Okay, any other questions on that? Yes?
Will you be closing that one? Will you be closing the downtown
so
one?
The downtown location will close, and we'll relocate to this big, beautiful building. Yeah, we're really excited about that, just because it offers the capacity of this building will offer you just more access to different services. Because right now, this current location doesn't have pharmacy services, for example. Shelly, remind me, is there a lab x-ray down there? So no lab or x-ray right now. So when we open this large building in May, that's Kaiser Permanente specific, that will give you access to more services. Question?
Before May, do you have pediatrics here?
Yes, I'm gonna go into that. Yes, great question. So what does your care look like right now? So we not only have that Kaiser Permanente medical office in downtown Eugene, but we also have our partnership with Peace Health. So what that means for you, and for those of you folks who have this book, I'll show you where that list is. Because of our partnership with Peace Health, you have access to additional services with Peace Health. So with our partnership, we have access to 5 medical offices and then 5 hospitals. Let me just show you right now. So if you go to page 18, so this is your list of access within the Eugene Springfield area. So for example, you have access to 5 Peace Health medical offices in addition to that Kaiser Permanente office downtown. You have your urgent care locations as well, hospitals and emergency care. So there are 4 hospitals that you have access to. And then we also have our partnership with pharmacies here in the Eugene, Springfield area. Okay. So for example, there's Albertsons, Huron's, am I saying that correctly? Yeah. Safeway. And then for those of you who have medications that you may take on a regular basis, so we do offer what's called mail order pharmacy. So that mail order pharmacy is through our Kaiser Permanente pharmacy that's located near the Portland airport. They make runs on a frequent basis. And so if you put in an order for mail order pharmacy, you'll be able to receive most prescriptions in the mail. So for example, if you have routine medications that you take, say, for me, it's like allergy medications, rather than having to go into the pharmacy every month, you can order a 90-day supply of that prescription, and then it's a cost savings for you because you're only paying 2 co-pays instead of 3. And we'll go into the costs in a little bit. Yes, question. Thank you.
You have 2 Safeway pharmacies listed, and neither are the Safeway that I use to fill prescriptions. Is it all Safeways or just these 2?
It's only the ones that are listed on there because that's a great question. So the pharmacies that are listed, that's whom we've contracted with, and so that's where you'd be able to access pharmacy services. So it's not all of the pharmacies for Safeway, unfortunately, just those 2. You know, Shelley, have you heard about any expansion with pharmacy services?
Up to the Pharmacy Guild. The Pharmacy Guild determines where we can be located, and they've limited us to 5 at this time.
Yeah. Okay. So I also want to share that you have additional ways to access services. Oftentimes we think when we need to go see our doctor that we have to take time of our day to actually drive and go to the medical office. We have other options for you to be able to seek services. I know we all have busy schedules, so we have what's called telehealth services. So what that means is with the Kaiser Permanente doctors, so specific Kaiser Permanente, you're able to access our 24/7 nurse advice line. So if something goes bonkers in the middle of the night, and you're like, oh, I'm not sure if this really warrants going into an emergency room. I want to get some medical advice over the phone. You can certainly call our 24/7 nurse advice line. They're able to triage your call with the physician that's on call and be able to help you address your concerns at any time of the day. We also have telephone visits that you're able to make appointments with our Kaiser Permanente doctors. Makes it really convenient if you have a conversation that you need to have that doesn't really warrant going into the medical office. You can certainly make a telephone appointment with a Kaiser Permanente doctor. And then last but not least, you also have video visits. So maybe you have a little one that has pink eye, for example, and the last thing you want to do is go into a medical office, right? So you can certainly make a video visit and then have that doctor examine you over the video. I actually did my first one actually a few months ago. It was a little awkward because I was like trying to make sure that my kitchen, because I was at home, like wasn't dirty, and I'm like, I don't want this doctor to judge me. But no, it was really convenient. I like being able to utilize that. Oh, and I'm sorry, last but not least, you're also able to email your doctor. So again, concerns that maybe don't really warrant you going into the office, you can email your doctor, hey, quick question for you. Here are some of my concerns, what are your thoughts? And then they'll be able to say, well, maybe you should come in and make an appointment. I want to see you in person. Or maybe they're going to be able to give you advice via email. So those are your options for what are called telehealth visits. Okay, so those are specifically for the Kaiser Permanente physicians. I do want to point out, so in addition to video visits from home, right now when you go into the Kaiser location downtown, a really neat thing, they have a room that's set up specifically for video visits. So right now there's primary care physicians that are there in that office, but let's just say you had like a need for specialty care. If it warrants being able to do a video visit, the doctor can actually set you up in a room. It's a really nice comfy chair in this exam room, and they have like a video capability set up. So you can do like a virtual visit or a video visit right there in that office. So fun and new, innovative ways to be able to help folks access care in a different way than going in person. Any questions so far? Oh, and I do want to point out, with all of these services, they are at no cost to you. So there's not a copay associated with any of these services. Okay, so this is what you're here for, right? Let me show you what page this is on. It might be easier for you to read. It's on page 13. So on page 13, you'll find your summary of your medical benefits. You do have Plan 1. So on the left-hand side, you'll see the various services, and then under Plan 1, you'll see the costs that are associated. I'm going to just do a quick high-level overview of this. So the great thing about this plan is it's a copay-based plan. So what that means is every time that you go in for an office visit or for service or to pick up prescriptions, you'll know exactly what your service is going to cost because it is copay-based. With this plan, there is no deductible, so you're not having to pay out of pocket for services before your plan pays for you. It's effective immediately. Your out-of-pocket maximum is $1,500 for the individual, $3,000 for your family. And then let's go over really quickly, just high level, what your copays are. So for example, when you go in and see your primary care physician, you'll know right off the bat, you're gonna pay flat $20. Emergency room copay is $100, and this is a question that comes up often. So if I'm traveling, what happens? Do I have to go to like a Kaiser affiliated hospital for emergency services? No, you don't. Whether it's domestic, whether it's, whether it's domestic, whether it's international, go to the emergency room if you need to. What happens is make sure you get that bill, bring that bill back to Kaiser Permanente. If you paid anything out of pocket, you'll be reimbursed. The copay for you would be $100 for emergency room visit, or we'll just make sure that we cover the bill. So you'd be going as if you were covered under your Kaiser plan. Okay. Same thing for hospitalization. So for hospitalization, it's $100 per day, $500 max per admission. So gives you a little bit of peace of mind, right? So you'll know even if you've stayed for more than 5-10 days, per admission, it's $500 max. Okay. And then for prescriptions, it's $5 for generic, $25 for formulary, $45 for non-formulary. Sometimes prescriptions can be less than $5 if it's generic, right? So you'll pay the lesser amount. $5 just means that's the max that you would pay for 30-day supply of your generic medication. And again, keep in mind that you do have that mail order pharmacy service. So if you have prescriptions you take on a regular basis, take advantage of that. If you're able to order 90 days, if your prescription allows you to do that, certainly do that because you'll save that one copay because you're only paying for 2 copays. Okay, question?
Do the medications that you pay for go towards your out-of-pocket cost?
Excellent question. So anything that you pay for, whether it's your copays for like office visits or labs, x-rays, pharmacy, all of that always rolls up towards your maximum out of pocket. The exception, however, is alternative care. So you'll see at the very bottom, you have self-referred alternative care benefit. It's a $20 copay for chiropractic, naturopathy, and acupuncture. So that has its own benefit max. And in this case, it's a $2,000 combined annual benefit max. And what that means is, let's just say you go and see like a chiropractor. Whatever that chiropractor bills Kaiser Permanente, that's what gets allocated towards that $2,000 benefit max. So I oftentimes encourage folks, if you're seeing one of those services on a regular basis, you're like, yeah, this is really working for me, but I probably should check in and see how much of this service I've consumed so far, just so I want to know how close I am to that benefit max. There's another sheet on alternative care services. I'll get right to you. If you go to chpgroup.com, that's who we contract with. CHP is Complementary Health Plan. So if you go to chpgroup.com, there's a phone number associated on that website. If you give them a call, give them your information, they'll be able to provide you with where you're at as far as your alternative care consumption. chpgroup.com is also where you would go to find that provider. So if you go to kp.org, you won't be able to find it. I've had a lot of folks do that. So if you go to chpgroup.com, that is exactly where you go to find that alternative care provider. Question?
Yeah, we were reading through your alternative care benefits flyer, and it mentions massage therapy, but it does not mention massage therapy on the medical benefit plan here. Does it cover massage therapy? Does our plan cover that?
So at this time, massage therapy is not part of your self-referred benefit for Plan 1. However, Because you are a Kaiser member, you are able to receive 20% off of whatever their customary fee is, as long as they're within the CHP network. Yeah, yes, great question. Any other questions so far on alternative care? I do want to point out, let's just say you've been seeking these services and you've maxed out your benefit. You're like, oh, I need to keep going because it's worked for me. Have that conversation with your primary care physician. I feel like so strongly about self-advocating. So if you have chiropractic services, again, for example, that's been working for you, share that with your primary care physician. Let them know and ask for referrals, because you can certainly do that. It doesn't hurt to ask, okay? Okay, so for a specialty care network within the Eugene, Lane County area, we have a contract with about a little over 750 specialists. If you're currently seeing a specialist and you're wondering if they're within that network, come see me or Shelly afterwards and we'll be able to pull that up for you, okay? But yeah, so this is our list. So Peace Health, Specialty Care, Pacific Women's Center, Slocum Orthopedics. So this is just a list of the specialty care organizations that we are contracted with. Okay. And then this is our website, kp.org/doctors-locations. That is where you can go to find a provider. Oftentimes people ask me, so are you required to establish care with like one primary care physician? Yes, it's helpful because the way that Kaiser Permanente looks at it is your primary care physician is your go-to person. That is someone that you can consult with about anything healthcare related. That is a person that you would go to with questions, concerns, referrals. So for referrals, that's whom you would have that discussion with. Hey, this has been really bugging me. What are your thoughts? Can you provide me with a referral to go see like an orthopedic specialist? So think of your primary care physician as someone that is like your, not necessarily medical home, but kind of like your home primary care physician. Does that make sense? A question that oftentimes comes up is, well, what if my preference has changed? Am I like tied to that primary care physician for the entire year? You are not. I know that things change for us routinely throughout the year, and if your preferences change at all, you are more than welcome to change your primary care physician at any time. We have a team that's able to help you with that. Okay? Oh, okay. So this is, again, our list of our pharmacies within the Lane County area. And then bear in mind, come May, we'll have another one added when we have our brand new Kaiser Permanente facility. And then for vision services, we do contract with Oregon Eye Associates and Peace Health Eye Care. So you can certainly give them a call and let them know that you're a Kaiser Permanente member. That's where you're able to make an appointment. And then alternative care, I think we went over that a little bit. Any other questions on alternative care before we move on? Okay. And on the, yes.
So you said if you've used all your benefit for the alternative care, you could get a referral. Yeah. So does that extend the amount? I don't.
It doesn't extend the amount because so the under Plan 1, it's self-referred alternative care. So once you get a referral from your primary care physician, then that changes the coding of it to be physician-referred alternative care. It doesn't impact your benefit maximum because this benefit maximum is specific for self-referred. If it's a referral from your primary care physician, then it's like in a different bucket. In that case, I believe the copay, Shelly, quick question for you. Does that copay then become a specialty or primary? We'll have to double check for you on that. That's a really good question. Okay, so on the back of your book, you'll see a list of phone numbers. So oftentimes, people are like a little nervous. It's daunting to be able to have to like think about transitioning your care, especially if you've established care with someone for so long. You're like, I don't know, I'm a little nervous. Okay, don't be, because in the middle of the book, we have what's called our new member welcome desk. I've had the privilege of sitting down with some of these folks when I first started, just to see what the process was. So new member welcome desk, what they do is they help with our members who are brand new to Kaiser Permanente. They're gonna help you transition over your health history. They'll help you transfer over your pharmacy history. They'll help you answer any questions that you might have, help you find like a primary care physician to panel with. And they're great folks to call, especially if you have like, maybe you have like a complicated health history and you're just like, oh, it's nerve-wracking. I need someone to be able to help me transition my care. Please know that this team is absolutely wonderful at doing just that. So don't be shy about bringing all the questions that you may have, any concerns that you may have, and have that full-on discussion with these folks on the phone, because they'll certainly help you identify primary care physicians, specialty care, and just help your transition be as seamless as possible. Okay. And then member services. So the 1-800-813-2000. So that's a great phone number for pretty much everything. This is like the Kaiser Permanente Northwest phone number. So this is whom you would call for if you wanted to like set up an appointment. This is also where you would go to access the 24/7 nurse advice line. They're a very helpful team. They're very expensive. So our account team, I am part of the OEBB account management team, as is Shelly Taylor. So we'll be available to help you guys answer any questions that you may have. I'll make sure to leave my contact information. So anything that comes up, you're more than welcome to email me. We can talk about it over the phone after today. I know there might be some questions that might come up. You're certainly welcome to give me a call. That's what I'm here for. I'm here to support you folks. Oh, and that is it. And that's beautiful downtown Eugene. Any questions?
I know this is being recorded, but I wanted to share my story. A year ago, I lived in Salem and I worked for an employer and I had Kaiser. And a year before that, my 19-year-old son had both his shoulders that were falling out on a regular basis for no reason. And his primary care there kept referring us to different surgeons in Kaiser, and the surgeons in Kaiser didn't want to do anything. They wanted to wait or do physical therapy. And in the meantime, I had a 19-year-old son whose shoulders would not stay in the socket. It was painful and everything. We went back to the primary care, and he told us about an amazing surgeon out of Kaiser that was in Washington, and he helped us get a referral, and my son was able to get double shoulder surgery outside of Kaiser for $75. And 2 years later, my son is doing great. He has bolts in both shoulders. None of the surgeons at Kaiser wanted to do it, but Kaiser literally took care of us. And I will never forget that. And I told Maria here that, like, Kaiser, I love Kaiser, because they literally take care of you. No matter if it's not in their network or not, they'll make sure you're healthy. So I love Kaiser.
Thank you for sharing.
Should probably work for
I really
Kaiser.
appreciate it. I didn't incentivize her to tell the story, by the way. So just in case you're wondering.
So
Yes.
the obvious question for me is, you have plan 1, 2, and 3.
Yes.
Where's the other side of what
Yeah.
we pay?
Yeah.
Like, doesn't everybody take plan 1?
That's a really good question. So are you wondering why Lane Community College has chosen to select Plan 1?
No, I'm wondering I assume that something about plan 2 is more expensive or cheaper than plan 1, and that buying plan 1 is more expensive.
So each school district and each community college has the option of choosing what plans are able to offer the group. So for this community college, they've opted to offer Plan 1. But why? Let's just say, if you're wondering, if you had access to all 3 plans, why wouldn't you choose 2 over 3, or et cetera? That's a great question. So I oftentimes like to kind of, the easiest way to explain it is it depends on your risk tolerance, right? So to not get too heavy into it, as you can see in Plan 2, like there's different cost shares. There's like a deductible, for example. And then there's co-insurance that's applicable for like major services like emergency care and hospitalization. So really, it's just, we can never plan for emergencies. But it just really just depends on your risk tolerance. Some people are able to maybe take that risk and be like, okay, you know what? I think Plan 2 will work for me. Does that make sense? Kind of? Okay.
Still, the question is, where do I find out how much more expensive Plan 1 is than Plan 2?
So I might be able to help you
Thank
with
you.
this. So Plan 1 is the only plan that the college is offering.
Got it.
In years to come, depending on how rates change, we may add Plan 2 because, as you know, the college is only going to contribute so many dollars. That's why they're offering different options, because different entities may not have the same type of dollar contribution towards the plan. That's basically it. So I'm going to use the example of the Smart Choice versus PSN with Pacific Source. As the rates went up, we started offering Smart Choice, and people were saying, well, this isn't going to be the best benefit, it's not the same. But when they looked at their out-of-pocket payroll deduction, they said, okay, this is actually the better deal for me.
So that's the answer
Yeah.
to the question. It's the out-of-pocket that I pay for Plan 1 versus Plan 2.
Correct, correct. And right now, with Plan 1, you're not paying anything.
Right.
Yeah,
Yeah. for
yeah, I mean,
a little while.
yeah, well, for this year, for sure.
Thank you.
I just want to make sure that, for example, I have kids and
Yeah.
I would like to find a pediatric.
Yeah.
So I could pretty much choose, if I find a pediatric in either Santa Clara or River Bend, is that like anybody in that facility or only
Correct.
certain doctors?
So anyone that's within the Peace Health medical offices that are listed on here, you're able
Okay.
to access
Perfect.
services with. Yeah.
Awesome.
I'm pretty sure you might have answered this.
Yeah.
I came in late, but I just want to hear it again because
Sure.
it's my mind, it's like no deductible. That's a concept I'm not used to.
Yeah.
So if my son's had 3 surgeries already on his knees through Slocum, we don't want to have another one, but I'm always wondering, and that ACL goes off again,
Yeah.
and we need another surgery. How does that work? The deductible? Could you just give me a scenario?
Absolutely. So with the Plan 1 that is offered to you folks, so like let's just say it was like an outpatient procedure. It's a little bit towards like the middle of the page. The cost share for you would only be $75 copay. So we'll just go over this real quick. So anything that has, like when you're looking at a benefit summary, anything that has like a flat dollar amount associated to it, that means that's a copay. Unless it says like a percentage after deductible, for example. In this case, it doesn't have it, but just so for your knowledge. If there is no deductible, that means you're not paying out of pocket to meet that deductible first before your plan kicks in, okay? So since there's no deductible, that just means flat copay for all of your services. Does that make sense? Yeah. Any other questions? And we can always speak one-on-one as well if you'd like. Okay. Well, thank you all so much for your time. I really appreciate you taking the time out of your morning to come speak with us and humor me through my presentation.